So the big question is, can you predict how your body will age? Sure, there are things that you can do to age more gracefully, diet and exercise and lifestyle choices, but in the end, your body is pretty much going to age how it's programmed to age.
That's right, and here with the age-fighting procedures for every decade to stop the clock is board-certified plastic surgeon Dr. Stephen Davis. Welcome.
Hi.
Good to see you.
Nice
so we're
to see
starting
you.
in our 20s. Is that true? We should start really...
Well, you know, what we're seeing is that people want to do things to make themselves look better at each one of these decades. So in the 20s, we start to see patients that want to maybe augment themselves, make themselves look fuller and better. So things that come to mind would be things like breast augmentation, lip enhancement, things like that that just kind of get a certain body part to be more accentuated.
It makes sense because you figure by your early 20s, you're like, well, I'm grown up now.
Yeah.
This is what I'm going to look like.
Yeah.
Right.
What do I want to do about that?
That's true. And if you know, if you didn't
sense.
like the way something was, I can probably tweak that a little bit. So in the 20s, that's what we see a lot of.
So now we roll into our 30s.
Yeah. Right.
And we're looking at ourselves in the mirror. Now maybe some changes have happened since we were
That's
20.
true. So in that 30-year-old range, I think some people may be trying to get a little bit more sophisticated in their look. Maybe they started to see things that they didn't love so much, and now they want to try to tweak that. So some of the things that come up are body fat areas, things that you notice that you may not have the same amount of time to exercise as you did back in your 20s. And now, can you do a little liposuctioning or something that'll maybe remove that unwanted fat from a certain area? And that's what we start to see happening in the 30s.
But it's not necessarily the invasive liposuction. There's another procedure that is less.
There are syringe liposuction techniques which are really more modified for smaller areas. There's CoolSculpting now where you can really do it totally non-surgically. But what's starting to happen is even though these decades have a lot of their own specifics in them, what we're seeing is because that genetic makeup is always there, can you be tweaking something from day one, let's say, where you're really trying to create a better look for yourselves so when you finally get older, it's going to be a better overall look.
You mentioned CoolSculpt. What exactly is that? And that's something we should do in our 40s?
Well, you know what? CoolSculpting can be done at any of these ages. It's really a way of getting rid of unwanted body fat without any surgery at all. It's an applicator that gets applied to a certain area that you know with diet and exercise, it's just not going away. And within an hour, that area gets frozen and the fat's gone.
Wow.
Wow.
Permanently?
Nice.
Like, do you have to go back for constant?
Not if that area is like treated. So I mean, someone that's really, the ideal situation would be a guy or a girl that's in the gym all the time and knows that the love handle, let's say, is just an area that no matter how much more sit-ups and
Crunches,
side bendings and things you're doing, it's not going away. You come in for an hour, those love handles gets treated, the fat gets frozen, and within 3 to 4 weeks, it's gone. It's literally
It's
gone.
fantastic. In our 50s, I think a lot of people start to notice the effects of time and alcohol and caffeine and sun on their skin.
That's true.
Yeah?
And that's why I think at that age, people start to say, you know what, I'm sorry I didn't start doing something back in my 20s and 30s about skin protection and doing something about skin care. But once you're in your 50s, we have a lot of very nice laser type procedures that aren't necessarily very invasive or downtime associated. And you can really do this almost on a monthly basis. You can do it every 6 months. And what happens is it almost strips away some of that dead, dried, old skin that you really did accumulate over all those years. And you can get a much more vibrant look in those 50s. Again, still not so much surgically related. Again, a lot of it has to do with what your genetic makeup is going to be, but somewhere around the 60s, even into the 70s, if you do have a lot of loose skin, that's where the surgical aspect really starts to come in.
But in our 50s, it's still some of those less invasive
skin.
procedures.
Absolutely.
Let's talk about the 60s then. What are we looking at?
Well, in the 60s, I think what I see in my practice is patients that may have kept up on a lot of good things, but they just have some loose skin. And the skin that may be talking about are things maybe by their breasts. It may be things around their abdomen. So they may have had multiple pregnancies. They may have been able to do things over the years to try to keep it together. But somewhere around the late 50s, early 60s, I think if there really is loose skin, most of the time that skin isn't going to be able to be lasered to be made tighter or anything else. It is going to be something that needs to be done surgically, which now, thank God, there's a lot of nice ways to do it as well where it isn't as long of
Right.
a recovery and things like that. So we're talking about tummy tucks, breast lifts, maybe eyelid surgeries,
Wow.
things like that that may start to come in.
Gravity is so unkind.
I know, it really
Gravity
is not
is just
fair.
mean.
And what about in our 70s?
70s, I have a whole swarm of patients that are in their late 60s and 70s
Wow.
that have always wanted to do certain things, and they just never got around to doing it. But one thing that I see is that everybody starts to say that their nose looks like it got longer.
Yeah.
And their earlobes started to get longer. How the hell did that happen, right? But what we can do is there are certain kinds of injectables that we can use even in the late ages that kind of reverse some of that appearance. And I think it's because, the facial skeleton starts to lose some of its bony mass. And all the muscles that used to be attached like that aren't so attached so closely anymore. And that's how you start to see some of the elongation of the nose, earlobes start to look longer. So we start to do things to those patients. Again, it could be surgical, but a lot of these injectable type products in the later ages of patients are just fantastic because some of these patients can't really do a surgery
Right.
because they may not be
Too
in the same
dangerous.
health.
Right. Do you do sort of whole life planning? Like, when you sit down with a client in their 30s, do you say, listen, stick with me, kid. I've got a vision for you, 40s, 50s, 60s. Do you talk about those
I
things?
really do, and it's been fascinating because a lot of these patients bring photos of themselves when they were younger, or bring pictures, or even sometimes bring their own moms in with them and say, look what I'm gonna head off to look like. What can we do about this, So, easy things to think about is, these little vertical lines that people start to get in their 20s,
Yeah.
patients will come in and go, I saw my mom the other day, and she's got these really deep lines. I got to start doing something with Botox to slow those muscles down so that that doesn't happen to me.
Interesting.
Okay, well, thank you very much.
Yeah, thanks
It
for
was
being
really
here.
interesting stuff.